Thank you everyone for tuning in to listen to my presentation on artificial intelligence in preventive cardiology this morning. I will talk about three types of prevention: primordial, which is preventing the risk factor; primary, which is intervening on the risk factor; and then secondary, which is managing disease after diagnosis. And artificial intelligence can help in preventive cardiology in three main ways. The first being analysis of extremely large data sets. We'll give a couple of examples as it pertains to primordial and primary cardiac prevention. Second, active monitoring of a wide variety of inputs. We'll talk about quite a few innovative examples of input in this category. And lastly, we'll give examples of very sophisticated prediction analysis. Some of the examples in this category feel too good to be true, but provides proof of concepts that can now be tested in the real world. For our review, we selected the following meshwords: artificial intelligence, cardiology, cardiology service, hospital, and went back 10 years until 2014. Parameters gave us 171 articles. Abstracts of all of these articles were reviewed, and only those mentioning any form of prevention were selected for full review. This gave us a total of 10 articles that were relevant for the preparation of this poster. So now let's get into it and take a closer look at these three unique ways in which artificial intelligence can assist in preventive cardiology by looking one by one at their applications with respect to primordial, primary, and secondary prevention. So let's start off by talking about large dataset analysis in the context of primary prevention by looking at the Jackson Heart Study, which investigated neighborhood cardiovascular health by following 4,000 subjects with no cardiovascular disease at baseline for 10 years to look for the development of their first cardiovascular event. The study identified discrimination burden, density of outdoor physical activity resources, and modified retail food environment index as some of the factors that affected the development of a first cardiovascular event. This is related to primordial prevention because subjects had no cardiovascular disease at baseline. Results of this study would be useful in determining where and how policy and community level interventions could best be targeted. For our primary prevention example, we'll scale up the capacities of our AI's large dataset analysis by looking at a study that investigated social determinants of health by combining three massive databases from the CDC, the EPA, and the Census Bureau. This resulted in a dataset consisting of over 20,000 census tracts in over 500 cities. The study considered 5 factors as being relevant to cardiovascular health outcomes: hypertension, diabetes, hyperlipidemia, coronary artery disease, and stroke. It then went on to see if these outcomes could be predicted by the following 4 domains: unhealthy behaviors, prevention measures, socio-demographic factors, and environmental measures. As far as coronary artery disease was concerned, the study identified proportion of cholesterol screening, leisure time physical activity, binge drinking, low income, and advanced age as factors predictive of coronary artery disease. Similar to the previous example, these results can again be used to guide how policy and community level interventions are targeted. Now moving on to our secondary prevention, we'll switch our data set to the electronic medical record and apply AI-based analysis to improve predictions for risk of readmission. This will result in EMR-based precision preventive cardiology, where we can use artificial intelligence-based risk prediction to select patients who may benefit from closer monitoring or review. So next, let's move on to AI's ability to actively monitor a wide variety of inputs. Here I will mostly talk about all of the latest devices that are available in the context of primary and primordial prevention. Combining these two categories together as there's a fair bit of overlap, and whether the device is being used for one versus the other type of prevention really depends on how you're using the technology. But before I move on to talk about the devices, I want to highlight this concept of whole genome sequencing. The genetic testing we're familiar with in clinical settings today is usually very targeted testing, usually first related to genes that may be related to a specific disease. If someone's getting wider sequencing, it is likely whole exome sequencing, which is just sequencing all of the coding regions, but that is still a very small proportion of the entire genome of a human being. Now, AI might play a crucial role in unlocking the entire genome's applicability in clinical settings, as it has already cut down the time for whole genome sequencing from 12 to 14 weeks to less than 1 second. If artificial intelligence makes whole genome sequencing a widespread practice, then it's possible that actively monitoring every input into the patient's electronic medical record in the context of their genome can reveal useful correlations in the patient's natural medical history. So now let's go on with the devices. We're all familiar with the increasing health applications of smartphones and smartwatches. All of them have accelerometers as well as GPS-based sensors that can provide useful information such as sedentary time and step counts that are valuable tools in both preventing risk factors such as obesity, as well as intervening on the risk factor of obesity after it develops. But for a lot of people, phones and watches are too cumbersome to wear all the time. And for these folks, we have something called a smart ring, which in addition to the accelerometer and GPS functions of our phones and watches, can also give you a full set of vital signs, as well as analysis of your sleep, including its quality, duration, and circadian rhythm. We have smart socks, which have pressure sensors built into them in addition to accelerometers and gyroscope that can give information not just about quality of walking that can affect joint health, but also about unsteadiness, which might have resulted from a particular treatment or might be the first signs of a particular disease too. Lastly, we have the smart shirt, which can also provide a full set of vitals, but it can also give you a VO2 max, 1 lead ECG monitoring, as well as information on sleep and activity levels. Now, putting all of these together for secondary prevention, we have this idea of the Internet of Things. It's kind of what it sounds like. Basically, anything that can connect to the internet can be integrated together and analyzed. Smart device-based monitoring has already been validated in diseases such as heart failure and atrial fibrillation. The latter has already had the ACC guidelines officially approve Apple Watch for monitoring. So there is now this idea that we can have an AI-powered assisted living facilities where all of these chronic conditions can be optimized using an AI-based system that can actively monitor and react to a dynamic set of inputs. Now, lastly, let's talk about perhaps the most exciting application of artificial intelligence in preventive cardiology, which is the ability to do advanced prediction. For primordial prevention, we have a novel scoring system which utilizes epicardial adipose tissue in combination with coronary artery calcium score. The epicardial adipose tissue is the novel information that is generated by AI, and this is done by estimating it from CT scans that may have been obtained for another reason. This composite score has been shown to be superior to either the ASCVD or the coronary artery calcium score alone. Now, those who have been following the artificial intelligence literature know that there's a lot of work around AI-based facial recognition for syndromic diseases that have obvious facial features, but now this concept has come to coronary artery disease as well. There is now proof of concept that AI is able to diagnose coronary artery disease based on facial features or photos of your retina. Making coronary artery disease diagnosis even less invasive than it is now will increase the number of people identified at the earliest instances of CAD so that they can be put on optical medical therapy and perhaps prevent their first MI. Moving on to secondary prevention, we'll look at what seems to me at least to be the most powerful application of AI-based prediction in healthcare, which is the concept of the digital twin. A digital twin is a virtual representation of the patient which can be used to predict disease as well as optimize treatment. For example, you can make your patient have hypertension or atrial fibrillation and then simulate response to various antihypertensives or antiarrhythmics, or see how modification of a particular risk factor could change the course of their disease. That was a lot to digest, but putting all of this together, it's clear that combining the powers of big data processing, ability to integrate massive amounts of digital data from network-enabled devices, as well as sophisticated prediction based on real-time monitoring of this data, results in a powerful tool that has various applications in preventive cardiology. Our review has shown that there is definitely proof of concept for several innovative AI-based solutions in preventive cardiology. It is now time for us to apply these concepts to real-life settings in order to assess their external validity. Thanks again for your attention.